Today I want to talk a little bit about diabetes, and I don't want to talk about the things that everybody talks about. Everybody talks about diet and exercise, right? Those are the two things that are just they're always associated with it, and they're very, very good things, but they've been covered so much. I want to talk about a different aspect to it. I'm Dr. Jeff Cumro, and I've had the pleasure of working with thousands of people over the last 15 years or so, really helping them to change their overall health. And my focus on this is changing the way that the brain works and getting the brain and the body to adapt to stress more readily, right? The more stress we have, the harder it is for our body and brain to work the way that they were designed to. So ultimately, if we can adapt better to that, then we experience overall better health. And this is true for diabetes just as much or more than anything else. One of the first things that happens in the stress response is that our body mobilizes glucose. Why does it mobilize glucose? What does the stress response do? It helps us to survive a situation, right? It gives us the energy to either run away or to fight whatever's facing us. So we have to have energy to do that. So it mobilizes that blood sugar so we're ready to either fight or we have the energy to run away. And that basically provides us the things that we need to safely navigate the environment that we're in. The problem with this is today the stress that we have never goes away, right? It's something that we're constantly faced with, whether it's the work we take home in our pocket or the kids events that are just continually multiplying. They're something that keep us busier than at any other time in history. There's always financial strain and traffic and family dynamics and all these other things that add to this. So stress is just a constant in our life, and when it's constantly there, our blood sugar is constantly elevated, and that's ultimately what we see with diabetes. So managing our stress does play a massive role in this. Now, what are some of the stresses that we face? Right now it's summer out and temperatures around here have been pushing 100 degrees. Heat is a difficult thing to navigate. It's something that actually stresses our body more than the cold does. If you need to evidence this, think about it. What are the major things that what are the major things that we experience when we face heat? Heat exhaustion, heat stroke are very common, right? They're not uncommon things. When we look at extreme cold temperatures, people might have a little bit of frostbite here and there, and that's a bad thing, right? That's obviously not something we want. But frostbite, it usually affects a couple digits or maybe a nose or different things like that. It's not a massive full-blown thing before somebody actually has a fatal attack from it. On the other hand, that heat stroke, heat stress is something that is significantly more taxing on the system and significantly more likely to end in a medical emergency, right? You're much more likely to die from those things. Same thing happens to your blood sugar on that. Your blood sugar goes through the roof. So if people are out exercising in the heat, if they're out working in the heat, if they're just exposed to the heat, especially if they're not acclimated to it, those are very, very dangerous things. And the same can be said for cold. If one of the highest chances of a heart attack is when it's really, really cold out and somebody goes out to scoop snow. It's still a stress on your system, but we see more of that in the summer than we do in the winter because that heat is a harder stress to navigate. It's not the only stress though, and this is the thing that we have to remember is, like I said, stress is always there, and it doesn't matter what kind of stress it is. It doesn't matter if it is perceived stress, and that's one of the most dangerous things. That's one of the most pernicious things. The things that you don't really see coming is, I guess I don't know how to describe this as well, but it's the gap between your perception and your reality, right? The things that you're doing to compare yourself to other people. Those are the most dangerous stresses because it gives us a difficulty in escaping it, right? Because if you're in that trap of comparing yourself to other people, it's always there. You're never going to stop that comparison. Every time you see that, you're going to see that comparison. And Dan Sullivan describes this in a way that I think sums up better than any other that I've heard. He calls it the gap versus the gain. And ultimately, we're all shooting for a goal, right? Whether that goal is survival, or it's financial independence, or it's raising healthy kids, or whatever that goal may be, we all have our goals. And when we look at how far we have to go to reach our goal, we're constantly going to be stressed, right? Because we're looking at that and we're like, I'm not there yet. I have this far, I have to accomplish this and this and this. I've got this much I have to do to get to that goal. Now, his other side of things is the gain. And this is where you look at, this is where I started, this is where I want to go, but this is where I'm at now. This is where I was a couple days ago. I'm here, I've made steady progress. I've made so much progress, and that is the gain that I have made. And that minimizes the stress because you can actually look at that and you can see you're progressing. You still know where your goal is, but you can see that progress as you go through there. It's not the constant stressor. And I don't know, this is something that I personally have always been bad about. I've always looked at that gap rather than that gain. And it does provide stress. And there are times when that stress gets the best of you, right? You stack enough of those things together. You add in fatigue. How many people are tired? Most people, right? Most people aren't getting enough sleep. The average night of sleep is like 6 hours, something like that. We should be getting 8 to 9 depending on the person. Some people need even more, especially kids. So you start adding in fatigue. You start adding in poor nutrition. You add in allergies or immune insult of different things like that. All of these things are constantly stressing us, right? Sometimes it can be too much. But with all of those things constantly there, our blood sugar is going to be higher. And this is one of the things that I see. 30% of people that end up with type 2 diabetes, about 30% of people that have type 2 diabetes don't even know that they're diabetic yet, which is obviously a problem. But 30% of people that have type 2 diabetes will progress to where they need insulin. So they don't ever regulate their blood sugar the way that they're supposed to. The diet and the exercise alone are not making a difference. So what are we missing? And in a lot of cases, it comes back to stress. We're not doing the things that we need to do. And stress is more than that. It can be, a candida yeast infection. That's a type of yeast that's in your system, and it pushes your body to want sugar. Why does it push your body to want sugar? Because it feeds it. The sugar is what it uses to feed itself. So it changes your neurology to actually make you crave sugar to feed it. Something that can be important to know, right? If you have that, it's going to be much harder for you to regulate that blood sugar because you're going to constantly be craving sweets. Heavy metals. Anytime you have heavy metals, it's the same thing. Anytime you have a viral infection, anytime that you have any of these other underlying things going on, it can constantly leave your body stressed, even if you don't feel that mental stress. And I see so many people that they're like, I'm not really that stressed. They don't feel the stress mentally. They've done a good job mentally of maintaining their stress levels. But physiologically, there is still an underlying stress. And that still affects your blood sugar. It still affects your sleep. It still affects your immune function. It still affects all of these other things that are underlying it. And this is part of the reason that we have so much healthcare issue in our society, right? We don't ever address that underlying thing. In our traditional medical approach, we focus on the symptom. We don't focus on the underlying issue. And that's what I'm going to urge you to do right now. And obviously, like I said, this is more directed toward people that are struggling with controlling their blood sugar levels, or they have that threat. They have prediabetes. They may have diabetes. They may just be worried because other people in their family have moved toward that. Their weight is starting to go up, and they know that that is a risk factor for them. Doesn't matter what situation you're in. We have to focus on the underlying things that lead to that. And if we don't focus on the underlying things, we're probably not going to get to that result. So, take a look at your life. What is the next step for you? For some of you, it may be just changing the mentality of things, looking at the gain rather than looking at the gap. When you take away that mental stress, it can help you get out of that mentally chronic stress state that drives your blood sugar up. For some of you, it might be further testing. Do we need to look and see? Do you have an underlying infection of some sort? Are you dealing with some sort of toxicity? Do you have some, nutrient that you don't have enough of? We have testing that is capable of looking at that. A lot of people don't know that that's available. A lot of people don't know that that's important in this. So is that the next step for you? If you're having trouble controlling your levels, then that might be a great fit for you. For others, it might be focusing more on diet and nutrition. That's like I said, diet and nutrition is a very, very important part of this, but it's something that's been covered by so many other people. There's great information out there. Obviously, if you need help, I'm happy to help you in any way that you see fit, but all of these things are what comprises health. It's not just one of them, and we can't just look to one of them to fix everything. We've got to look at the whole picture. And once we have that whole picture, we know a little bit more where you need to focus. You need to focus here. Somebody else needs to focus here. Somebody else over here. But when we can target that, that's where health lies. That's where you're able to see those transformative health changes. So I love you. I appreciate you. As always, I know that your time and your attention are your two most valuable resources. So I really, really appreciate you spending this time with me. If this is helpful for you, please like, subscribe. It gives me a good indicator that this is information that you find that's a good fit for what you need, and I can provide more of that stuff. So you guys have yourself a great week. I love you, and I appreciate you, and I'll catch you on the next one.